Hello.
Hi, we're just starting in a few minutes. Just hang in there.
Hello.
Hi, yes, good afternoon. We're just starting in a few minutes.
Okay, sir. Okay, I'm waiting.
Thank you.
क्या क्या हुआ माँ?
Hi, good afternoon, good evening, everyone. Thank you so much for joining in. My name is Akshat, and I'm taking care of today's webinar and also the process for US. So we'll just wait for 5 more minutes for your colleagues to join in, and then we can proceed ahead. So just bear with us for 5 minutes. Please be on mute so that your
Okay,
just
we are waiting. बात चल रही थी ये बाकी नहीं कैंडिडेट आए थे पड़ता वीडियो में Oh.
Sure. We'll just wait for, I mean, we'll wait for everybody else. I mean, if anybody else can join in during the time period of this webinar. Thank you so much, everyone, for joining in, for taking out time today to join the third series of the webinar, which we are conducting in order to help you all realize your dreams for USA. My name is Akshat. We have our guest speaker today, Mr. Chandra Madan, founder for Nursify Group. We are one platform which connects nurses with the hospitals across the world. This time we came up with the first world country, which is US right now. So we'll be helping you with this. Before going ahead, I have listed down a few questions that I will be asking him regarding the process, regarding what exactly are the questions. You can, in the meanwhile, put in the questions in the chat box, or maybe unmute yourself once I am done with my questions. So you can unmute yourself, maybe type in chat box if you have any questions, but we will want to make sure that every one of you gets their clarity for the upcoming face-to-face interviews that will be happening in Dubai and Abu Dhabi in the next 3 weeks. Thank you so much, Mr. Madan, for joining in. Yeah. So yeah, any introductory words from you, and then we can start with the questions.
Thanks, Akshit. Hi, good afternoon, everyone. As you said, my name is Chandra, founder of Nursify, and we are very excited to present to you a very, very unique opportunity to realize your US dreams. And I'll also cover very soon some of the news we're seeing in the media around H-1B. I will cover that specifically as well, as many of you, I'm sure, are very concerned. But for now, I want to let you know that we are going to be in UAE, Dubai, and Abu Dhabi in the month of October, and we are hiring more than 300 plus nurses in a very, very short period of time. Great, all the reputed hospitals from Indiana, specifically Indianapolis City, are going to be there, and we look forward to meet all of you to get to know more about you and help you support your dreams. And Akshit, of course, is there on the call, but we also have Marie. Marie, maybe you want to come up on the video if possible. She's based in Dubai, and we'll be happy to speak to you or answer any questions that you may have. But today we'll start with a list of questions. The whole idea of this webinar is help you realize your dreams. So make it as interactive as possible. Akshay will start with few questions that you have already sent, but I would love to interact with all of you to see if there is specific queries we can answer. Over to you, Akshay.
Thank you so much. Okay, so Mr. Madan, the first question that I have in this is how many vacancies are there in total, and what specialties are we looking ahead for?
Sure. So as I said, we are in this round, we are hiring more than 300 plus nurses in a span of next 4 weeks. We will be physically there in Dubai and Abu Dhabi between 20th and 24th of October. Specifically, we're going to be there from in Dubai on 20th and 21st, and in Abu Dhabi on 23rd and 24th. We'd love to meet all of you. But before that, as Akshit will roll out the form, please register and provide all your details, because a lot of work needs to be done before you come in there. So it's not going to be we'll take some walk-ins, but mostly it's going to be a fixed appointment. We will fix up the time with you. We'll speak to you. We'll help you with the screening process. And as soon as your screening is done and your resume is shortlisted by the employer, which is Indiana University Health Hospital, you are pretty much there. So short answer to the question, we're looking at 300 plus right now, but the demand for talented nurses like you is ever growing. US needs at least 130,000 nurses in the next 5 years. So that's around 30,000 every year. So demand is huge. For this round, we're hiring 300, from UAE itself in the 4 days of recruitment drive that we're going to have. But as I said, the demand exists. And many of you should not worry about the recent announcement by Trump about H-1B visa fees and all that. I want to settle that up front, because many of you would have that question. We have got a clarification that the healthcare worker visa or nurses visa is exempt from this process. So you should not see any bottleneck, and you should see H-1B visa process H-1B visa to be processed for you, and you can land in USA within 6 months' time.
Sure. Mr. Madan, the next question that I have here, and I have for everybody's information, I have put in the link that you can register yourself on. So if anybody of you wants to register for this the walk-in drive that we just mentioned, you can register on the link below and fill in the details there. The next question that I have, Mr. Madan, you said Abu Dhabi, you said Dubai. You mentioned about the dates as well. So where exactly are these? What is the location of this face-to-face interviews?
Yes. So these are going to be happening in Intercontinental Hotel in Marina in Dubai, and we are going to have Intercontinental Hotel in Abu Dhabi as well. So the exact location and we can send you the pin closer to the date, but be prepared to be there on 20th and 21st. Sorry, either 20th 20 or 21st, or 23rd or 24th if you're in Dubai and Abu Dhabi respectively. And these are closer to the metro station, so you should not have, at least in Dubai, you should not have any difficulty reaching there. Very, very centrally located, and we look forward to meet you. And in these places, by the way, when we do the recruitment drive, it's not just meet and greet or just information sessions. These are hiring drives, which means the hospital is going to be there. They would love to meet you, get to know more about you, and if they like your profile, they will offer on the spot. Okay, so stay tuned for more updates, but we look forward to see you all there. And if you are in some of the questions you may have, if you're in Saudi or other GCC countries like Qatar, Kuwait, some in Oman, as long as you can travel to Dubai or Abu Dhabi, we would love to meet you, okay, as well, at least for this recruitment drive. If you can't travel and you are still eligible, then we will speak to you after the event. But right now, the focus, virtually in that case, for now, the focus is more on the recruitment drive so that we can, we can be there and we can speak to you. The hospital will be there. They like to speak to you, and they would like to offer you there and then. That's how fast the process is. And once the selection is done, you will be receiving offers immediately, and we'll be moving very, very fast within 4 to 6 months' time. Oh, here you go. Marie is here. She's based in Dubai, and you can always reach out to her if you have any questions, and will be, of course, will be there in the event as well. Yeah. Hi, Marie. Yeah.
Hi, good evening, everyone. Okay, thank you, Mr. Chandra, for inviting for this event. Yes, everyone. So I'm based in Dubai. So Akshit will actually roll out this whole webinar. But later on, like if you need to, for instance, meet me virtually or physically or to discuss further on this process, you let us in the chat box as well. And so I'm reachable anytime, whatever the questions you need. And like Mr. Chandra said, this process we are going to make it's going to happen very fast, so we're going to make it as smooth as and fast as possible. So yes, you can reach out to me. Thank you, Mr. Chandra. Hi, Annie.
Thank you. And I'd like to also welcome Annie Fernandez, advisory board member of PNA. Thank you, Annie, for joining, and she's also based in Abu Dhabi. We would love to see a lot of Filipinas as well joining the recruitment drive. Welcome, Annie. You're on mute. You want to say something?
Hi. Hello, good morning to everyone. Yes, so I'm from Abu Dhabi, so I can be helpful here. So welcome to Abu Dhabi.
All right. Welcome. Okay, Akshit, let's go ahead. Akshit, you're on mute.
Sorry. So I was asking, so hospital will be there in the recruitment drive. So are the hospital providing on the spot offers, or what? How exactly are the decisions made?
Yes. So I think the decisions are going to be made very, very fast. Usually within a day or so, you know the results, if not on the same day. And you can expect to know the result. I mean, if you are there, there's 90% chance you are through, because you have already gone through a very, very rigorous process. And I'll talk about that, requirements in a minute. But if you have all the documentation, like your past NCLEX, you've done visa screen, you have the English scores, and you have the nursing board registration, and you fit into any of the categories like ICU, medical surgical, ER, you are, most likely 90% through with having met all the requirements. And if you are, you make a spot in the event, which after a lot of rigorous process, we will shortlist, 95% you are through. Okay. So the offers are going to be made on the spot, because the hospital would like you to be there no later than, April timeframe. So you should be ready to travel within the next 6 months' time if you are planning to go to the US. And Indiana State, the Indiana University Hospital, salaries are one of the highest I have seen so far. It's $55 per hour plus signing bonus plus all your relocation taken care of. Okay, so great opportunity, immediate offers, and I would encourage. I can see a lot of new names, faces here. I would encourage all of you to apply for it, talk to our recruitment consultants, and make sure you reserve your spot as quickly as possible.
Sure, Mr. Madan. Mr. Madan, you mentioned about the salaries and the few benefits. What are the other benefits that candidates can look for if they are applying for this?
Sure. So just to summarize, at a very high level, salaries are one of the highest in the US, as far as I know. So if you're working in a day shift, it's $55 per hour, and you'll be working for 36 hours per week, roughly about 2,000 hours per year. That means that you'll be able to make at least 110,000 US dollars per year. This is without any, overtime and shift allowance and everything. If you if you opt for night shift, the salary is $59 per hour. And also, you get signing bonus of $5,000 once you land there. You will get one-way air ticket for you. Your visa, H-1B visa, is sponsored, and you'll be surprised. Your visa is usually processed between 15 and 30 days. Okay, and you should be able to go there as quickly as possible. And by the way, 1 month accommodation. So your visa, sponsorship, 5,000 signing bonus, 1 month of accommodation, your air tickets are taken care of. And by the way, if you have, if you have young kids, the education is completely free. Okay, so that another advantage you will get. To be frank, it's a very, very lucrative offer, and they are hiring in bulk. More than 300 plus nurses will be hired in those 4 days. So make sure you can you can book your slots as quickly as possible. We've already filled about 50 slots, so there are 250 more to go in last 1 week itself. So please send in your resume. Please talk to our recruitment consultant, and we should be able to get you one of the best offers that's possible in the United States. Okay.
Thank you so much, Mr. Madan. The next question that I have here is about the eligibility criteria. What is the eligibility criteria that nurses should have, and do they need to have NCLEX or they need to complete the visa screen? What exactly should be the eligibility criteria that they should be coming in for?
Sure. So, so as I said, we are processing H-1B visa, and although I addressed this point in the beginning, I think some of you are still asking on the chat, this 100,000 fees, is that going to impact nurses? Simple answer is no. Don't worry. In the evening, enjoy your favorite drink, because this is not going to impact nurses. Okay, so you can celebrate already. Number one. And I want to say this upfront, because none of you should have any doubts around this. This H-1B visa and the 100,000 fees. No restriction for healthcare workers, because America needs a lot more nurses. Yeah. Coming to the qualification and the requirements, you should be a BSc nurse. You must have done a BSc. You should have NCLEX. You should have passed NCLEX. You should have started visa screen process, and you should do the rightful English exam like OET, IELTS, PT, or TOEFL for the visa screen process. Indiana Nursing Board does not require an English license, so there's no requirement of specific English test. But for visa screen, you will require an English test. That could be anything between PTE, IELTS, etc. Okay. In terms of So BSc nursing, your education qualification, your NCLEX certificate, visa screen, and nursing license registration, and of course IELTS. If you've done visa screen already, you must have done IELTS or TOEFL already. Second, you should be working in ICU, ER, or any of the medical surgical department. Okay, the key is you should have bedside experience. So if you are, now some of you may ask a question, are hemodialysis experience accepted? If I have oncology experience, that's accepted. If I have a orthopedic experience accepted, yes. All those experiences are accepted because that's form part of broad umbrella of medical surgical. Okay. The important requirement is wherever you are in the world, you should have a multi-country experience. Okay. So if you're working in UAE, in any of the Emirates, and you have had your home country experience as well, you are a very, very strong candidate. And let me tell you, you are competing against very, very talented nurses who have anything between 10 years. I think minimum experience we have seen so far is 10 years. Okay. So, and I love it because the client loves it. If you have so much experience working in UAE or any of the Middle East countries, they know that they're getting a gem. And trust me, that's what the client tells me. Okay. Nursing profession is very, very highly respected. And these experience in the Gulf countries, or any of the UAE, Emirates, is worth, I wouldn't even say gold, it's worth diamond, right? So you have a great experience and you must encash that, because your salary levels are going to be at least 4 to 5 times more than what you get from your current job. Okay. And the profession is very, very highly respected. And, you can be in the US. Of course, you work in Indianapolis, but, you also get to enjoy the other kind of side perks of being in the US, and your family life is going to be very, very different. Okay. So great opportunity for you to be there and, make the best out of this.
Sure. Okay. So the next question that I have here will be based upon what are the documents that the candidate should carry in order to move ahead in the process. So what are the documents that they should carry to the interview drive? What are the documents that they should give us, and how exactly they should be doing the process?
Sure. See, although we're taking you as H-1B visa, okay, these are going to be ultimately converted into EB3 visa after 6 months of your landing. So some of you have a question, no, I don't want H-1B, I want only EB3. H-1B visa is kind of a stepping stone for you to be there immediately, like within 6 months. And once you land there, within 6 months, the hospital will apply EB3 visa. So, simple. If your visa screen is done, so we need visa screen certificate. Of course, you pass NCLEX, and you should have a nursing board registration. So you should have a US RN license, copy of your educational qualifications, and of course, your IELTS or English scores. As long as you have it, I think you are, you don't need to bring anything. We will collect all of that before. And of course, your passport, your valid passport needs to be there. So, and as I said, of course, your experience that you mentioned on your resume, you should be able to substantiate that. So if you require, although we usually don't require, but if the hospital asks for it, we may ask for the experience certificate. Now, I said ICU, med-surg, and ER as specialty. You could be working in any ICU. It could be cardiac ICU, it could be general ICU, it could be adult ICU. Yeah, it must be adult ICU, not pediatric. And even if you worked in pediatric ICU, you should have some experience of medical, surgical, or ER or other adult ICU for you to work in the in the USA. Okay, so very simple set of documents. On the day of the interview, if you have submitted everything, you don't need to bring anything. Although we are little hesitant to accept just walk-ins, but if you have friends who are coming in, but they have to wait, okay? If you have friends who like to join, refer them, bring them on board right now, ask them to fill up the form, because some of you, I can understand it's a Sunday, and I do appreciate all of you taking out the time on a Sunday to talk to me, because I know I'm taking away time from your family time. So thank you for joining. But if you have friends who couldn't make it, make sure you tell them to fill up the form and join as well. Yeah. All right, Akshit, back to you.
Thank you so much. The next question here I have here. You mentioned that this would be a EB3 and H1B visa both. What is the typical timeline from interview to selection, then to actual deployment to the USA?
Yeah, so interviews are going to be happening in 1 month's time. Usually, you should expect an offer no later than within a week. Most likely, it's going to happen on the spot. So within 1 week, you should be able to get and accept the offer. And from there on, I would say about 1 to 2 months of visa process, getting the documentation in, getting all your visa screen documents, over there, validating those and filing for petition for H1B, which should happen within 1 to 2 months. And after that, within next 2 months to complete your accommodation, tickets, etc., you should be able to get there so from the day you get selected, which is October, week of 20th October, within 4 to 5 months, you should be able to land on US soil. I don't see, any issue getting there between 4 to 5 months. Yeah.
Okay, thank you so much. So then the next question that I have here is, how will we help the candidates, and why should the candidate go ahead with us, and what kind of support will we be providing them in this opportunity?
Sure. So first of all, Nursify is a global platform. We have been working with, majority of clients or quite a few hospitals in US, UK, Canada, and UAE. So, we are well respected by, or at least we have the trust of at least 30,000 nurses on our platform. Number one. Number two, this process is absolutely free for you. Nobody's going to ask you to put in any money in the process. In fact, your visa screen process, your visa process, as well as your relocation process is taken care by the hospital. And Nursify is your partner right from the day you register with us, and we will help you screen. If you need help in training on interview, we'll train you on the interview skills. You need help with your resume writing, because there's a specific way the US hospitals expect those resume. We'll help you with the resume writing. And we will also be your partner all throughout the process in case you need help with licensure registration, resume writing, interview skills, guidance on which forms to fill, documentation, and help organize your interviews with the hospital, which we're doing now. Of course, we're doing a face-to-face drive, but at times when there are virtual interviews, we'll help you set up those interviews as well. And then once you're selected, we'll guide you through the offer acceptance, documentation, visa process, your travel, accommodation, and your final landing. And we don't leave you. after you even land there, right? We'll be there with you to help guide you to settle in the US. We have teams based out of US who will help you locally, who are the local experts. If there are aspects of cultural training, because culture in Asia and culture in Middle East and in the US could be slightly different. So we'll fill you in on the, I won't say nuances, but the cultural, the gaps that are there, so that you're not shocked once you land there and you're well prepared. So right from screening to interview to offer to visa process to postal support, we are there. Nursify will be by your side in your journey to realize the dream. Okay, so you can count on us. We have, of course, people like Murray based out of UAE, but we have teams all across the globe, Akshit and team, and then recruitment consultants will help you to complete the process. And sometime, by the way, they may be chasing you. So I apologize if they're being a little bit of a, I would say, pest sometime. And the reason we are sometimes nagging you is we want to close your process as quickly as possible as well. Okay, so it's in your benefit. So Nursify is there by your side, right from submission of forms to curation to screening to all the way up to the postal support after the visa. We are there with you, and we would love to help you realize your dream, as quickly as possible.
Thank you so much. I would now request everybody. I'm so sorry I have missed out on the questions. So I would request everybody to actually put in the questions in the comment box if you guys have any questions. If anybody of you would want to unmute themselves and then ask a question, they can do that as well. But make sure that this is not being done in rush. So if you have any questions that you want to ask, you can unmute yourself. Just raise your hand, unmute yourself, and you can ask whatever questions you have regarding this process for the USA. So I'm sure you all have a lot of questions that you wanted to ask. So please put in the chat box, or you can unmute yourself.
Yeah, there are already some questions on the chat box, Akshit. Maybe you want to take them?
Actually, I exited the meeting in the meanwhile, so I don't have those questions with me right now.
Okay, no problem. I'll try to take some of the questions. So I've been attending webinar. This is TDEP. I've been attending your webinar twice already, and I asked Chandra before. I'm eligible to apply, and no agent from Nursify contacted me. I'm sorry about that. Akshit, can you share the link on chat? Please fill up that form, and apologize for the delay. One of our consultants will be able to get back to you. The next question is, I'm in Saudi Arabia, can't go over to Dubai. What should I do? Again, if you're in Saudi Arabia, first of all, for this recruitment drive, please try to visit Dubai or Abu Dhabi. I think Abu Dhabi will be probably closer in the week of 20th October. If you can't make it, please do send us the form. We can always consider you for future opportunities, which means I'm not saying future in next 2 years. Next 2 years, it is going to be happening in next few months. So we can always have virtual interviews as part of the process. Yeah. Next question is from Alia. I'm working in Saudi Arabia since 23 years. I want to move to the USA. You're welcome, Alia. Send us your documents on the registration form that has been shared, and we will be happy to take your process forward. Again, if you are in ICU, MedSurg, ER, or even if not in these specialties, send your resume if you pass NCLEX. If you haven't passed NCLEX, sorry, we can't consider you for this time, but we will definitely consider you once you've done your NCLEX. Next question is on the requirement. I think I reiterated that. BSc Nursing, NCLEX, and BSc Nursing, NCLEX, visa screen, all of that needs to be done before we can take your application forward. Okay. And by the way, I forgot to add, you should have minimum 3 years of experience, which I'm sure many of you already have that. Can you give me more details about salary for ICU? Yeah, it's $55 per hour for the day shift and $59 per hour for the night shift. And in addition to this, you will be able to make, quite a bit of overtime, and all the relocation cost is taken care of for you already. Okay. And again, very important question. I'm sorry, on the risk of repetition, I will take this question. It says, does the news related to H-1B visa yesterday affect us? Short answer, no. Okay. So that news does not affect nurses because we are, first of all, following the process of uncap or exempt H-1B visa. And secondly, those visas and the healthcare visas are exempted from the announcement that came out from Mr. Trump. Okay. I have no more words to add from Mr. Trump because he keeps making the life difficult. But anyway, I will stop at that. What's the requirement for NCLEX exam? What English exams are accepted? So NCLEX, you need to pass NCLEX for any of the state. If you haven't done a US exam, you can also apply with the either Australian or Canadian exam and transfer your license to US. It will take some time, but you can get there as well. In terms of English, either of English test, IELTS, TOEFL, PTE, everything is accepted. How to get a spot? Actually, they shared the link. You should just fill up the information and then we will take it from there. Then the next question is, I'm from Nepal. What should I do now? Will I be contacted? Yes, fill up the form. If you meet the requirements, we will be contacting you as quickly as possible. Again, there's a question on this Trump 100,000. I won't repeat that because I just answered. What about dialysis nurses? Yes, even if you're a dialysis nurse. So the question is, if I have experience which is not in ICU, med-surg, ER, send us the detail. Okay, we would like to evaluate. Sometimes I have taken nurses, who have different experience, but a well-rounded experience. Okay, so we will consider that dialysis nurses for this round as well. Visa for how many years? Is it 1 or 3? The H-1B visa is going to be for 3 years, and after 1 year, they will apply for EB3, which is a green card, which means you can stay there for life. Okay. What's the score? What is the score accepted for OET? Yes, you will be required to have an OET score of B overall, okay, to apply for this. What about medical insurance for candidates? Yes, medical insurance will be covered at a subsidized rate. So you may have to pay small amounts, but medical insurance will be taken care of. If you don't, I don't have NCLEX or OET, can I apply? I'm sorry, you will need to complete NCLEX first before you can be eligible for the program. Okay. Is there any contract? Yes, I said 3 years of contracts. And then the other question is it okay to apply for H-1B visa if I have an ongoing EB3 application? Yes, you should be willing to get relieved from that agency. As long as you can do that, we'll be able to take your application. Okay, somebody had to leave, Rosalinda. So the recording of this meeting will be available. This webinar will be available to all of you. My colleague Akshit will send it out, or you'll get from a Nursify email ID. So you will be able to catch up on what you missed over there. Okay, then there is a question on Nepal. What's the process for USA? I think once you're done from any country, if you've done NCLEX, we will be able to consider you. Okay. Next question. Yeah, OET score, I've already answered the question. Hello, sir. Is the contract H1B or EB3 pathway? Yes. So the current so is it H1B or EB3 pathway, and maybe know the name of the facility? Yes. The name of the hospital is Indiana University Health Hospital. There are multiple hospitals within that group in Indianapolis. You will first go on H1B visa, and after 6 months, we will apply for EB3 visa. So you should be able to get a H1B visa first, but later on, you'll be getting the green card. Okay. I'm NCLEX. Next question from Darwin. I'm NCLEX passer, currently working as an aesthetic nurse here in Abu Dhabi, and I don't have recent bedside experience. Am I still eligible to apply? So Darwin, can you maybe unmute yourself? Do you have a previous bedside experience, Darwin? Darwin, can you hear me? Okay, so if you have a previous bedside experience, you can send your resume on the form and register on the link. We will be able to look at your resume and can guide you better. But technically, if you have a previous bedside experience, we can take you as well. Is pediatric ICU experience not eligible to apply? I'm willing to get trained if they allow. Okay, so, and your IELTS is booked in November. So I think if you're willing to be trained, we'll take pediatric ICU, we'll consider, but you need to do your IELTS in October itself for you to be eligible for this recruitment drive. So I think you can apply, but you need to do your IELTS as quickly as possible. Next question from Samsung phone, I guess. My US RN license is from Illinois. Do you do the processing or endorsement of my license to Indianapolis? Yes, very good question. So it doesn't matter where your US nursing license is from. Once you are selected, you can endorse it to Indianapolis and we can help you with the process. You need to pay for the cost though, okay? PT is accepted. Yes, PT is accepted. So you can apply for Indianapolis job with the PT scores. In fact, IELTS, TOEFL, PT, IELTS, TOEFL, PT, and OET is also accepted. Okay. Is health medical insurance covered? Yes, it is covered. Okay. All right. Next question from Jem. If I have EB3 visa awaiting to be current, can I still apply? Yes, absolutely, you can apply, and we'll be very happy to help you. In fact, when we apply for EB3, we'll be able to take care of your priority date as well. All right, those are the questions I have on the chat. Maybe are there any other questions? You may want to raise your hand or unmute yourself and talk. Akshit, maybe let's facilitate.
Yeah, of course. So if anybody else is, I'm sure not anybody else, but if you feel your question was not answered properly, if there are anything that you might want to ask in that, you can duly unmute yourself and ask the questions that you have. OET score, how much required? I don't have your name here, but it is to be B. So now, if anybody else has any question that they feel needs to be answered or put in more importance on, you can unmute yourself, and then of course we'll be able to answer those questions. Sir, can you mention the date of slot interviews upcoming in October? I missed the initial part of the interview.
Yeah, the interviews are happening on in Dubai, 20th and 21st of October, and in Abu Dhabi on 23rd and 24th of October. And you know, so you can book for one of the slots. And the other good question that gets asked, and somebody asked that as well, Dil Kumari Karki is asking the question, what's the age limit? No age limit. We have sent people who are as young as 21 and as younger as 60 as well. Okay, so don't worry. You know, I think age is not the criteria at all that we are worried about. Okay. And then the next question is, health and medical insurance will be covered by the employer, including the family members. I think your insurance will be covered at a subsidized rate for you. And you know, you will take care of it, but majority of the portion will be subsidized by the employer. Okay. All right. Any other questions? All right. So, Marie, you want to add something?
Hi, thanks once again. I think all the questions were answered. So whoever who has still have inquiries or probably missed the webinar, or you heard about it later, or you just joined later, so you can reach out to the helpline or any of the numbers, either Dubai number or Nasify main numbers. So you can reach out to us. So we will answer whatever the queries that you need.
Sure. Thank you, Marie. Yeah, there are few more last minute questions, I guess. Experience gap, how much of experience gap is accepted? Look, I think if you have experience gap of about a year in between, we can take that. As long as, or even 3 years, we can take that. As long as recently for last 2 years, you've been working. Okay. That should be good enough. Then the next question is, do you have agency help to take NCLEX exam? For this recruitment drive, we are only taking NCLEX passers. But in the future, if you want to go for it, yes, we'll be happy to help you on the NCLEX exam as well. Okay. All right. Any other questions? Okay, great. So remember, our date of the event is in the week of 20th October, 20th and 21st in Dubai, 23rd and 24th in Abu Dhabi, both in Intercontinental Hotel. In Dubai, just to clarify, it's the Marina Intercontinental. It's great to have all of you here, especially on a Sunday. I know you've taken all the time. And, you know, I know, and thanks to Annie, I think a lot of people from Filipino Nursing Associations are also here. And so I would say apply for the opportunity. This is one of the fantastic opportunity I've seen with great salaries and very, very easy deployment within the next 6 months. Okay. So look forward to see you there. Akshit has already shared the link. Please apply on that link and reach out to us, and Nursify friendly recruitment consultants will be happy to help you to take the process forward and help you realize your dreams. Once again, thank you so much for joining. Akshit, back to you, and have a great weekend.
Great.
Akshit,
Thank you so much, everyone, for joining in. After this webinar, you will be getting a WhatsApp and a mailer from our end, which will have the same link and also the recording. Request you to please go through the recording. If you guys have any questions, fill the link when you are if you are willing to apply. This is a wonderful opportunity. We'll be looking forward to receiving your application and then speaking to you one-on-one. Thank you so much, everyone. Have a great week. Thank you.
Thank you. Bye-bye.
Thank
Thank
you.
you.
Bye.
Bye.